There's a new therapy, that's come out in the last year or two, that are CDK4/6 inhibitors for metastatic ER-positive breast cancer. And I think it's really changed the way that we treat people. I mean, these drugs really now double the time, the progression-free survival that women have with metastatic disease, from like a year to 2 years, and in some cases even longer. So these women are on these drugs for a long time, and what they do is they inhibit an enzyme called CDK4 that's responsible for cell cycle control in women with ER-positive metastatic disease, and they're very effective with anti-hormonal therapy. So the big issues really, with these drugs, the biggest issue is because they inhibit not only CDK4, but an enzyme called CDK6, and CDK6 is responsible for maturation of neutrophils. So really the biggest side effect of these drugs, and I'll ask you about other things you've seen, but the biggest one seems to be neutropenia. And these drugs are dosed, at least in terms of palbociclib, 3 weeks on, 1 week off, 3 weeks on, 1 week off, with very specific criteria.
Right.
And one of the big things I always used to kind of talk, when I talk about this and I speak about this all over the world, was talking about my interaction with you guys, the nurses, and I'll get a call, their neutrophil count is 500, what do we want to do? Or the neutrophil count is 700, what should we do? You want to talk about how you guys manage that? Because it's important for people to know it's okay to have neutropenia, but you just need to adjust the dose of the drugs based on it.
Well, when a patient starts the drug, we plan, at least for the first 2 to 3 cycles, to check the blood counts every 2 weeks. There are parameters that have been put out that we can go by as far as holding the drug or rechecking the labs. We certainly do a lot of education with patients initially about what it means to be neutropenic, what that means, the precautions that they can take to keep themselves healthy. Having patients have their lab work every 2 weeks gives us the best way to know how things are going.
Right.
And then we can change doses accordingly. As we know, there's 3 different doses.
But sometimes the best laid plans happen. I mean, as we know from this very morning, someone's getting cataract surgery tomorrow, and she happened to stay on her palbociclib. And she's getting it tomorrow.
Right.
And so, what do? We have to do a CBC and tell her to kind of stop it and maybe hold the cataract surgery. I mean, these are the sort of things that happen because the people feel so well on these drugs that they want to go back to do all the other things they normally do.
Absolutely. I think the number one side effect we see is the neutropenia, but fatigue is a big complaint.
Fatigue is a big one.
But patients do need to be aware that the Ibrance does need to be held prior to certain procedures.
Yep.
We found that with some patients, the schedule of taking them can be a barrier. Knowing when to get the lab work, knowing when to not take it, and we try to educate them the best we can how to take that drug the same time every day. Get your lab work done. Notify the nurses if you have a fever greater than 100.5, any signs of infection. So it does, on a patient's part, it does, remembering to take it every day. So there's as opposed to coming in every 3 weeks for an IV, a drug, on their part, they need to be actively involved, and plus let us know if something's coming up, whether it's dental work or cataract surgery or anything, so that we can accordingly tell them what
hold
they
your
need to do.
Ibrance for like a few days before, so your neutrophils, because the neutrophils recover very quickly. So if you hold it for a day or 2, they'll probably come back. One thing, and you kind of said this a lot, and I'm really curious to see how you guys deal with it. You've talked about fatigue. What do you guys tell patients about fatigue? How do they deal with it? How do you help them deal with it?
I do explain to patients, just again from what I've heard from patients over the years, is that this is a fatigue, a cancer-related fatigue is unlike any fatigue they've ever had. They can't necessarily sleep it away. There's a lot going on with the cancer and the body fighting the cancer and the drugs killing the cancer, that they are going to be tired, and they do have a license to take a nap. That's what I tell them. That they do, but if they feel energetic, if it's their day of treatment, they get steroids and they for pre-meds, and they feel great. Take advantage of that. Go for a walk. Do what you need to do. But on the days that you do need to rest, then rest. If you find that your fatigue is interfering with your daily life and you're not enjoying life, if it's keeping you from doing things, then it becomes a problem. Then we need to really take.
So what do we do about it? What do we do when it's a real problem like that? What do you guys recommend? Then you come to us, but we throw up our hands and go back to
well, I mean, we have, we have tweaked doses if the drug is just too much for you. I've had physicians in the past order low-dose steroids for energy.
You've done that too. Things like I agree with you. I mean, I
Yeah.
think if they're anemic,
But
we'll
I think-
transfuse and do things like
Right, and the
correct what
best-
we can correct.
Right, and the best thing that we do is tell them to take is, eat as best they can, make sure they're hydrated. That is a huge part.
Hydration's huge. Now, that's probably a part more fatigue. There's probably more fatigue because of like subclinical dehydration than we
Right.
really realize.
And
agree with
I
you.
don't think people, because people will come in and get a liter of fluids and they're like a new person.
Correct.
So, making sure they drink enough. But again, just to really keep us posted on how the side effects are interfering with their life. And just letting them know that when they're done with their cycles of AC, or or they're done with that things should,
Get
we,
better.
we,
I agree.
but sometimes it's hard for them to think that far ahead.
I agree.
And it
We
can
have
be
to
really
encourage them. We have
discouraging
to
for them.
encourage I agree. I agree with you. Good.